changed and what is different is how effective home isolation is. Our typical practice for usual cases is that isolation at home is acceptable when a COVID case reports that they have a separate bathroom and bedroom in the house, and that they could stay there for the full 10-day period of their isolation while they are infectious. Anyone who lives in the same house or household as these individuals would start their 14-day quarantine on the day that the positive case enters isolation in the separate part of that location. That is the practice that has been in place for many months, but variants are far more contagious. As a result, we believe that the chances of this home isolation of cases in being effective is lower. That is why we are now saying that if the case remains at home for the full time they are considered infectious, household contacts are considered to be exposed each day that they share that household. That means that a 14-day quarantine for anyone in the household starts on the last day that the positive case spends in the home while infectious. If the variant case leaves to an isolation hotel or another location where they are not living with others to complete their isolation, the 14 days for contacts starts at that point in time. If the variant case and their contacts all stay in the same home for the full 10-day isolation period of the case, then the 14-day quarantine for the contacts starts after those 10 days are finished. When I mentioned yesterday that a maximum quarantine period for household contacts of variant cases could be up to 24 days, what I meant is that the combination of the 10 days the case is infectious plus the quarantine period of 14 days for contacts would be the maximum potential required period for contacts to remain in the home. I am sorry for any confusion this may have caused. We are updating our website and will be creating new materials to help assist anyone who has questions about this current policy. Turning to vaccines, we have now administered 109,341 doses of vaccine in the province, and almost 19,000 Albertans have now been fully immunized with 2 doses. I have recently heard some questions about a small number of people who may have inadvertently skipped the line and received the vaccine before they were eligible. This is an issue of public trust, so I think it is important to address it here. Public health officials have determined the prioritization list based on risk and science. Any situation where individuals attempt to access vaccine before they are eligible undermines that trust. The allegations that have been made are unfortunate, and it is understandable why many would be upset. That being said, overwhelmingly, the prioritization list has been followed carefully across Alberta. There may have been confusion about eligibility of other first responders when paramedics were added to the list, and this may have contributed to an error. Alberta Health Services has clarified with EMS providers who is eligible for the vaccine at this time. I know that many Albertans would love to be able to access the vaccine right now, and I thank everyone for waiting their turn. I am grateful for the way that Albertans have recognized that we are receiving very limited doses of the vaccine right now, and that they have supported our focus on starting with those who have the highest risk of severe outcomes. We will take situations like this as a learning opportunity and strive for clarity of definitions of who is included in the sequencing of vaccine eligibility going forward. As soon as the supply increases, we will be able to start offering more first doses and expanding eligibility in the weeks and months ahead. Turning to today's numbers, over the last 24 hours, we have identified 259 new cases of COVID-19 and completed more than 6,800 tests. Our positivity rate currently stands at about 3.5%. There are currently active alerts or outbreaks in 307 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 746 cases. Overall, our school-aged new daily case numbers are about at the level they were at in October and they continue to trend downwards. There are 539 people in hospital, including 94 in the ICU. Sadly, I must announce that 11 new deaths were reported to Alberta Health in the last 24 hours. I know the pandemic makes it difficult to grieve and come together like we are used to doing, but there are safe ways to get the support you need to help you through this challenging time. I encourage anyone grieving a loved one to reach out for help if they need it. With respect to Alberta cases of variants of concern, I know that many have questions about the variant cases identified as linked to a daycare yesterday. Health officials continue to reach out to all families and staff affected by this outbreak to ensure that everyone has the supports they need to isolate or quarantine safely. We will release the zone name once this notification has been completed. Today, I would like to talk briefly about the path forward that we are taking in this province. I know that many Albertans have strong feelings about how restrictions are being eased, with some feeling that we are moving too slowly and others who think we are going too fast. Both of these perspectives are understandable, and as I have often said, there is no one right way to navigate this pandemic. However, I would like to put our current situation in context to help explain why we are not approaching relaunch like we did in the spring, and instead are pursuing a more cautious approach. Currently, there are 539 people in hospital. This is down from the high of 938 on December 30th. This is a very encouraging trend, and pressure is easing on the health system that we all rely on. At the same time, our numbers remain far higher than they were in the spring. When we started our first relaunch on May 14th, there were 57 people in hospital, a tenth of the total that we have today. Similarly, we now have 6,599 active cases. This is less than 1/3 of our peak of 21,231 active cases on December 13th, and all Albertans should be proud of that fact. But once again, it's also important to remember that when we relaunched in the spring, there were less than 1,000 active cases in the community, meaning that there are almost 7 times the active cases today that there were at that time. To be clear, our province has made remarkable progress over these last 2 months. We have bent the curve, and every Albertan can be proud of that. I know that these gains have required deep sacrifices from many business owners and other Albertans. At the same time, it is important that Albertans understand we are at a very different place than we were at in May. Our caseload is higher, our hospitalizations are higher, and the emergence of new variants poses a threat that could cause cases to spike again if we are not careful. That is why we are not relaxing measures for a large number of sectors all at once, like we did in the spring. It is also why we are moving slowly with restaurants, fitness, and those sectors that will see some restrictions ease on Monday. It's important that we take a slow, phased approach to ensure we aren't doing too much too fast, especially as we learn more about the new variants of COVID-19 and work to prevent their spread in Alberta. By also closely watching our leading indicators of positivity rate, new case numbers, and growth rate, we will be able to see if the tide is turning and if we need to pause moving to the next step. This approach should limit the need to jump back and forth between easing and tightening of restrictions, which I know is challenging for everyone, especially those whose businesses and paychecks are affected. I know that we would all like to get back to a world that looks closer to the way it did before. We all want businesses, sports teams, and cultural activities open and available for everyone to enjoy. The best way to make that happen is for all of us to be extra serious about following the guidance and measures in place and to work extra hard to prevent this virus from spreading. Our previous success in bending the curve doesn't guarantee it will happen again. Our actions now will help determine how fast we can proceed and whether we can continue bringing our numbers down and moving safely forward. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please? This is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. How many cases of the COVID-19 variants are active in Alberta right now, and how many cases do we need to see before either further restrictions are introduced or the planned February 8th loosening is canceled?
We have 57 cases of variants of concern. I don't know how many are currently active, so we would have to take that away and get back to you. So that diagnosis of variants of concern does cover a long period of time over the last several weeks, and so we'll have to get back to you on how many are active. With respect to a threshold of variants of concern that would potentially change the plans for easing measures on Monday, there is no specific number of variants of concern. What I will say is that we are watching carefully our case counts, and we are making sure that we're paying close attention to those leading indicators of the trend of new cases, of positivity rates, and of growth rate. And if those things begin to change, those are the things that will determine whether or not we can proceed with our stepping forward as we've planned, or if that needs to be paused or changed.
Operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. So on that note about those other metrics, you mentioned case counts, R-value, positivity rate. They will all factor into the reopening plans, but there have been no specifics released about how those will come into play. So what are the specific benchmarks for those indicators that would see a pause or a step backward in the roadmap? And if you will not release them, how come?
Those, again, specific benchmarks are under discussion. We are looking at having a very low threshold. So if we do start to see cases growing, we would not want to see cases growing really at all, but we don't want to see them growing at a high rate. And so the specifics of those are being finalized with respect to what would cause us to move backwards. But overall, our ultimate goal is to keep our case count trending downwards is the ideal. Stable is possible, but less ideal. And if cases start to go up again and positivity rate starts to go up again over a period of time of a few weeks, that, of course, will be a cause for concern and will trigger a discussion about whether or not we're able to proceed with reopening as planned.
Operator, could you put through the next question, please?
Next is Lauren Krugel with the Canadian Press. Go ahead, Lauren.
Hi, good afternoon. I had a question about the household contact who may have to quarantine for up to 24 days. Just wondering how confident you are that those people, if they do have to quarantine that long, will stick to it. It's quite a lot to ask. And also just what the take-up has been on the hotel rooms to isolate that has been offered.
I don't have a number for the hotel rooms that is up to current numbers today, but I do know that we have had an increase over the past few months. And of course, that isolation hotel option is an option, whether it's for somebody who's diagnosed with that variant of concern and they themselves need to isolate, they could go into an isolation hotel for the duration of that 10-day period. Or another option would be that the close contacts of that case could take the option of quarantining in one of those hotels. So I want to be clear that the 24 days is not a requirement in all cases. It is the combination if someone chooses to stay in their household with their household members, and we know that they're infectious up to 10 days from the onset of their symptoms, then those household members, again, could potentially be exposed at any point in that time and would need to quarantine for 14 days after that last exposure. So with respect to how many people will be compliant with that, of course, the discussions that the contact tracers and case investigators will be having with individuals who have been diagnosed with a variant of concern or who are contacts will emphasize how much more transmissible this variant is and how important it is to follow these measures, as well as any supports that are required. So we want to make sure that people do have that option of going into, again, an isolation or quarantine hotel if they are not able to safely separate from their household again, because we have seen how much more infectious these variants are.
Operator, could you put through the next caller, please?
Next is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hi, Dr. Hinshaw. How does the vaccine task force determine the priority people within all the groups that have been approved for the vaccine get one? So apart from the fire chiefs in St. Albert that appear to have jumped a queue and got the vaccine, I've heard of other cases where nurses who are retired or on maternity leave or who expect to be gone for 6 months or longer, hospital administrators who do not have direct patient contact are getting the vaccine. This seems to be against at least what has been said publicly about who's going to be getting it and why, and that being because of their direct contact with people who could have COVID-19. So is AHS making sure that the people who are getting the vaccine do have direct patient contact? How do you do that? And if not, are administrators who are in offices getting vaccines before seniors and other vulnerable groups in Alberta?
We have heard reports of individuals, some of the ones that you're referencing, who did receive phone calls for making appointments for vaccines. So you may recall that in December, when we got an early shipment of vaccine and we moved forward with offering that vaccine to healthcare workers, because at that time we could not move the vaccine from the location to which it was delivered. The way that we operationalized that was that Alberta Health Services contacted the managers of intensive care units and those who were listed as respiratory therapists and got lists of all of the people who worked in those units. And then those lists were used to make phone calls to those individuals to let them know that they were eligible for a vaccine. So there may have been times where there was a list of those who worked in a particular intensive care unit. Perhaps it included somebody, as you mentioned, who'd maybe gone on leave. And sometimes those lists may have not been entirely up to date. And what I would encourage is all of those individuals who may have gotten that phone call. At this point in time, the eligibility notification is often going out by email. So if there are healthcare workers who are getting those notifications and they know that they don't fit that criteria, it likely is the result of, again, a list that perhaps wasn't entirely up to date. And so I would encourage those individuals to let AHS know that actually there was an error and they're not in that eligible category, so that that vaccine can go to one of those individuals who does provide that frontline care. So again, that is not a deliberate choice in terms of adding people to the list who were not a part of the criteria, but was a result, again, of trying to reach out to many thousands of people in a very quick way. And unfortunately, in some cases, those lists were not entirely up to date, and there may have been some people on those lists who, for various reasons, had moved on, and there may be people who were not on those lists who needed to be. And we're working with Alberta Health Services to make sure that processes are put in place to fix that. But ultimately, again, it is a challenge when we're trying to move very quickly and trying to contact large numbers of people in a very short time period.
All right, we've got time for 3 more questions. Operator, could you put through the next caller, please?
Next is Aaron Collins with CBC National. Go ahead, Aaron.
Hey, Dr. Hinshaw. Thanks very much for taking my question. This is sort of a follow-up to an earlier question, and thanks very much for clarifying the new restrictions for folks that are in home contacts for those people with the variants. But I have a question about that. It seems that it is quite convoluted as to who would have to stay for the whole 14 days. I mean, it makes sense when you lay it out there, but is that actually something that you can enforce? I mean, with all due respect to the contact tracers that are calling and informing these people about what they should be doing, I mean, is there any efforts to actually monitor these people, and will there be any specific ways that these things can be enforced?
With all of our measures, we are grateful for the participation of Albertans in keeping rates down. If we had to enforce every single one of our measures every single day, we would not be able to keep our communities safe. And so the vast majority of Albertans who are contacted are willing to keep their communities safe. They're willing to do the right thing and make the right decisions. For those situations where it is difficult for someone, if they don't have the resources, we have specific groups of the contact tracing team who are able to provide information in different languages, who have different backgrounds, who may be able to help people who perhaps need a bit of additional information to understand what options are available to them, what supports are available to them. And when it comes down to that last piece of enforcement, where we are seeing in very, very rare cases egregious violations where people are not following the requirements, in those very rare cases, then it is possible to take enforcement action. But those are rare and isolated cases, and the vast majority of Albertans are keeping their communities safe. They're doing the right thing. And what we're doing is working to make sure that they have the information about the increased risk that this variant poses and why in-home isolation for someone who's infectious is not considered adequate because of the transmission that we have seen.
Operator, could you put through the second last question, please?
Next question is Jesse Wisner, Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. Thanks for taking my question. Yesterday, you tightened rules around quarantine for household contacts of those who are positive for the variant. Infectious disease specialists say that indicates that a high level of concern. You've alluded to additional measures you were looking at with the variants. So what specifically are you looking at, and where could they be enacted, like in schools or workplaces?
So the one measure that I discussed yesterday was, of course, the fact that in-home isolation with multiple people living in the same household is no longer, again, considered adequate protection against transmission. And that's one thing that we have made that change. In addition, we have, as I mentioned, required any close contacts in any situation of a variant of concern to have 2 tests in their quarantine period. So we are requesting people who perhaps have had an initial test. Often what happens is someone who's a close contact will know that they're a contact of a COVID case and may have already gone for a test when they've first been notified. It does take a little bit of extra time to do the variant testing, and so we're now phoning back all of those cases and contacts who had previously been notified to give them that additional information that the person who has the infection, that it is a variant of concern, and what additional measures they need to take. And for those who are contacts, again, to have that double testing and to be sure that they are aware that they have been in contact with this more infectious strain. In addition, as I mentioned, we are looking whether or not there are other measures that need to be put into place. We're having discussions across the country with other provincial and territorial public health leaders to determine what we may need to do nationally. And so, again, final determination on some of those pieces has not yet been made. But we are looking to see whether or not other pieces need to be put in place to protect against spread of these variants.
Operator, could you put through the final question, please?
Final question is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. I would like to know if the province is considering starting to test asymptomatic people again to discover more variants. We spoke to an expert who told us that this might be a good way to control finding these new variants on top of the sequencing that you're already doing every day and every week.
We are, as I mentioned yesterday, looking at rapid testing in irregular screening programs in some locations that have high risk of transmission. And so that is one way that we're looking at potentially expanding testing in targeted locations where we know that if there's introduction of a case, it can cause rapid spread. With respect to the PCR testing and testing of asymptomatic people, we have a low threshold for offering testing when there's any indication of an outbreak setting, when there's anyone who may have been in close contact. So we are offering testing to asymptomatic people in all of those environments. and that we have been doing so for many months. Whether or not we open it further is something under discussion, but the benefit that we're likely to see is more when we look at those higher risk settings, in addition to very low threshold testing when there is any potential for exposure, which is again what we've been doing for some time.
Thank you all for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.